Hey, welcome to the MC Cats Talks. Let's talk, let's share, let's smile, let's celebrate, let's learn. Share, subscribe, call a friend, let's join this. The MC Cats Talks. Share with us, sit down, relax, let's enjoy the show. Views expressed here don't necessarily belong to us. Please leave a comment, share with us, give us your views. We're open minded. We talk health, entertainment, normal life, and normal situations. Calm down, smile with us, enjoy the journey. Remember, it's the MC Cards Talks. Tell a friend to tell a brother, tell your mama to tell a cousin, tell your husband to tell your wifey. Join us here. Hello, how are you? How you doing?
I'm okay.
We're going to first of all introduce ourselves. What's your name, my brother?
I'm called Dean Vyamkama.
Uh-huh.
I'm a senior nursing officer.
Senior nursing officer. What does a senior nursing officer do?
This is someone who has acquired a master's degree in nursing. Yes.
Okay.
But currently I work with at clinic by Regional Referral Hospital.
How did nursing end up into math? Just explain first of all somebody what's math.
Yeah, MAT is, in simple terms, it's called medically assisted treatment. And this one is used to manage what they call opioid use disorder. Or
still the English is an opioid disorder is still hard English. Okay,
opioid use disorder. Opioids are a class of drugs. Sometimes we use them to manage pain. Yes, and
like addictions, like cocaine, crack.
And leave alone those ones first. Here we are looking at the ones that are readily available in the hospital. We have morphine, we have tramadol, there is pethidine, all those are kinds of opioids.
Before even going further, I have a doctor who's going in schools and advising about these drugs, and most parents don't know that these drugs are in pharmacies. Yes. Like they are sold in the pharmacies. Somebody, even in schools, some teachers don't know these drugs. Olyazireeta ku ssomero n'agamba zino I have say my drugs. How does somebody see these drugs?
Actually, opioids, these are not supposed to be sold without a prescription from the doctor or health worker.
Let me tell you out of experience. I had a friend who was addicted and bribed the pharmacist. Say if he's going to buy for 50, he tells them I'll give you a 20 extra.
Okay. So when you look at the policy from National Drug Authority, opioids are strongly managed, and these drugs are strongly
subscription. It has to come from a doctor or something.
No, yes, it has to come from a doctor. These ones are guided drugs. So without a doctor's prescription, there is no way a pharmacist has to, or a dispenser has to sell to that drug. Okay, that is according to the policy of NDA.
Okay, let's mention the drugs again, just for someone to ever see them and know something is wrong.
Yeah, there is tramadol, which is commonly used for pain, and then we have morphine. This one is used mostly in those sickle cell patients, and also management of chronic pain. It could be bone pain, it could be any chronic pain. Then there is also pethidine.
What does pethidine do?
Pethidine is also, this one mostly is used in minor surgeries, but also it is used to control pain.
That's the one that makes you doze off. Because I have a leg problem. They gave me one. The pain was too much. So they gave me one and I was like in heaven. I was like, this could be a good height.
Yeah, those are the drugs you get.
And initially, they're not supposed to be sold without
a doctor's prescription.
Okay, for parents out there, for people who don't know this, so let's take to a person who works in a rehab. Yeah, what are the things you're facing? What problems are you facing as a person who's working in rehabilitation? Sorry, I have coffee. I'll share with her.
Right now, in rehab, in 2025, there are two sites of MAT, one in Mutabikaaa and one in Bali.
I've had the Mutabikaaa one so many times.
Yes, so there is one of...
Let me tell you just a small story. I used to go to the ghetto where this person was taking these drugs. And they would tell me, just buy me one, I sleep because I'm going to Mat in the morning. That's how I got to know Mat. And it opens in the morning, I think closes at 1, so you have to be there early.
Yes.
Yeah, explain more. Mat is free because we never used to pay for it.
No, Mat is free.
Wherever there is a Mat,
yes,
it's free. That is Mutabikaaa and
by the Regional Referral Hospital.
By regional, okay.
Yeah, so currently we have only 2 facilities in the country. That is Mutabikaaa and Bale, who are doing medically assisted treatment for people who are abusing opioids or who have opioid.
Why don't we use an English word, who are addicted? Or
who are addicted.
Who are hooked to crack, cocaine, ice,
exactly,
whatever you...
Yeah, so who are addicted to those drugs. Mat is an evidence-based management. This one was recommended by WHO to treat addiction of opioids. Okay.
How was it funded? Because these drugs, most of the drugs you use for addicts are a bit expensive. When I was paying bills in drugs rehabs, those drugs are quite expensive. So you people are giving them out free. How are you giving them out free? Is it government? Is it
initially,
an NGO?
When
Keep
this
program coming in.
Okay. When this program started, for Mutabikaaa started earlier, I think around 2020, 2021, but from Bale started in 2024. These programs were funded by NGOs, and the one of Bale, the one of Mutabikaaa was being funded by Reach Out to Mbuya. There's a project called Reach Out to Mbuya.
What was that project? Where was that money coming from?
That money was coming from...
Why I'm persisting about money, because I know how expensive rehabs are.
Yes.
And I know how expensive those drugs are, of which somebody has to get like 2 or 3 per day. Okay. So I know the costs. I'm replacing what, if you don't mind.
Okay, that's fine. So for Reach Out Mbuya, I think Reach Out Mbuya is a CDC. It was a CDC region, so money was coming direct from CDC.
What is
was
CDC?
CDC Center of Disease Control.
Okay, that's government, yeah?
No, that is an American-based organization.
Okay.
Yes, but it also funds most of the HIV/TB programs in Uganda. So CDC was funding, and also USAID was also funding. So they kind of divided the regions. The regions.
Okay.
Yeah, because in the east, where there is Bale, it was being funded by USAID under a project called Local Partner Health Services, which was being implemented by Baylor Foundation in Uganda.
Okay, these all NGOs and words are many. The English word I would ask, was this money from government or it was coming from abroad?
No, initially these were grants. These were
grants from the United States.
Yes, grants from the United States.
Okay, we shall get back there. You were telling me something there about people who are using drugs, and you were breaking it down, how it comes to sexual, how did you explain it?
Oh, okay. Yeah. When we are looking
at... There's a circle, the way you were explaining it.
Yes.
How it's affecting and connecting to HIV/AIDS.
Okay, I think there is, when you look at people who are addicted to drugs, we know what an addiction is. We know what an addiction can cause.
Addiction is you can sell anything, do anything to get a drug.
To get that drug.
And you have those turkeys.
Exactly. So when it comes to sexual exploitation and taking advantage, this one mostly affects the women. Those women who abuse what? Who abuse drugs. Yeah? Who have that addiction to a certain drug. So they are oftenly sexually abused and also sexually coerced. In the sense of I'm giving you sex, you're giving me money for drugs. Exactly, you're giving me
money.
But
me, I've seen that in the nightclubs. I've seen it so many times.
Yes, you're giving me money, I get that drug, or you're giving me that drug.
Oh, okay.
You get it? Yes, then there is also heightened gender-based violence, especially in the people who abuse drugs.
Yeah, they tend to fight.
Exactly.
They tend to be quarrelsome, always complaining about things. And
very true. So when we are looking at the prevalence of HIV in this category of people, We categorize them as key population. Yeah?
Okay.
So when you look at the HIV prevalence in these people, it is high. It's around 17%.
Wow.
That's by WHO. Yes.
Okay. Let's go back to the reason why we're here. Right now that
but also in addition to that, that is in the general people who are, that is in the male side, because we'll be looking at these ones who inject themselves, where they keep on sharing needles,
yeah,
of which they don't know the
the
status of
other
the person who
persons.
used
Oh
it.
yeah, help me with your needle. Help me with your needle.
Exactly.
Yeah.
But also,
I saw that in the ghetto too.
But also on the side of women, it is again high. The prevalence is at 24% in women who.
These are statistics you've studied.
Yes, these are statistics by WHO.
24% most likely to get HIV through drugs and drugs they're using by piercing.
Okay, drugs they're used by piercing
and the sexual
side. So for women who abuse drugs, their prevalence of HIV is high. It's 24%.
Okay, right now this drug issue, even in America, it's like I saw a documentary and they say they've never had a problem like the drug problem is bigger than even the economic crisis in America right now. And now that America is not funding, initially you said you were getting money from USAID.
Yeah, we're getting money from USAID.
Yes, so there's no money right now.
No, actually, in 2025, when the President of the United States, that is His Excellency Trump, when he came into power, I think the first policy, the America First policy was, I think, revising the foreign aid.
Yeah.
And also cutting off all support which was deemed unnecessary. So
among the things,
yes.
I like the way they deemed it unnecessary.
Yes, so among the projects or among the activities that were, they used to call it life-saving activity. So they thought math was not a life-saving activity. So it is among the activities that were dropped.
We don't have any kind of like government helping or funding on this most of that math direction.
Government right now is supporting and funding the drug we use in math. That is the methadone, the one we use.
Yeah, I've seen methadone.
Yes, that is the drug we are using.
Is that the one they inject?
No, they don't inject it. It is.
They're tablets?
No, they're not tablets. There are two types. We have methadone and buprenorphine. So buprenorphine is amphotericin. Those are the tablets. The methadone is you
just
take
for
it
somebody
like
that have taken the
yes.
how does this work? How does this help an addict?
Yeah, methadone. Anyway, we have skipped a lot of things, but methadone is given to an addict. Most of the people consider it as a substitute of what the
something
person
can replace. Yeah.
Yes.
Because I've seen them sleep the whole day when they've taken that medicine.
But ideally, it is not a substitute. This drug is given to you to control the withdrawal symptoms of the other drugs. Yes.
The vomiting, the diureting, the shaking, the fever.
So this drug is given you to control the tackies.
Tackies are those things or which are feeling dead drugs. You've seen people shaking or vomiting or quarreling a lot when it doesn't have that drug. At but the drug is saying helps you calm down.
Yes,
these tackies.
Yes. And
I think the part of drugs, the worst thing is tackies. If you've seen somebody on tackies, oh God, it's ugly.
And the good thing with it is it's a long-acting drug. It can stay in your body between 12 to 36 hours. You get it? It's not like these street opioid drugs where you have to inject yourself
every now and then. Yeah. Which and you're also spending money.
Exactly. So that is methadone. Methadone, I don't know if I should explain what exactly it does to the body or...
How does it help? Just give us brief talk.
Okay, how it helps, it's just that for it will come in as something given to you to control the tackies, the withdrawal symptoms. You get it? So that even though you have not used that drug, you can like go to work, you can go and do
your normal. You go back because drugs can get you normal.
Exactly.
Let's get to the problem, then we shall go to the part where you said you skip just because of time and people don't want to listen to long things. What problems are you facing right now that you don't have funds, and who are you calling out here to help? Because as far as I know, Ministry, I think it was Ministry of Health, there was a fund for drug addiction and all that. When they were reading the budget, there was something in between that direction.
Okay, so currently the problem we have, one, right, MAT is a component, is a program. It's not only giving the drug. So in MAT, we give you the medical assisted treatment, we give you the drug to take.
The counseling,
yes, we do the psychosocial support.
What is psychosocial
That
support?
which involves the counseling.
Yeah, I've seen that.
Yes.
I've even had them call, are you okay? How come you've not come out? You've taken long.
Exactly. Then also, we screen for HIV, TB, and hepatitis B, and also manage them.
You manage?
And manage, yes.
Yeah, because I saw you do blood tests when you start.
Exactly. But right now, since there is a lot of integration, such people are referred to the chronic care clinic. Yes. And also we have what they call socio-economic empowerment. That is also a component in that. So socio-economic empowerment is one of the leading causes of relapses, where we give someone
relapse is when somebody goes like to rehab now and uses the drugs again after like 2-3 weeks.
One of the drivers of relapses, one is not having something that keeps you busy.
Yeah, that's one. I noticed that. Yeah.
Yes. Then the second one is unemployment.
But I went to the gate and I was seeing there are lawyers and doctors.
Then the third one
failed me to understand what they were doing.
The third one is poverty. All of us get these addictions in different ways. Remember, you can get an addiction through negligence of a health worker.
What do you mean?
For example, they have prescribed tramadol for you as a painkiller. Yes. And after injecting you, I'm supposed to give you this drug 8 hours. After 8 hours again. But patients tend to come and cry of pain. Say, I'm sorry, injected, even before the 8 hours elapse.
Oh, yeah.
Then the negligence of those health workers, because you're complaining a lot, they'll come and add you that.
And the patient is just wanting to feel that vibe.
Exactly. So in the long run, you get addicted.
Addicted, yeah. I've heard of that. I think that was Jackie Chandu's story.
Yes. Then there are these ones who get addiction through, especially our ladies, those ones who have painful cramps.
Oh.
They are lied to be taking those capsules of tramadol.
Yeah, to reduce the pain for the cramps.
Exactly. So
and later on, after even the cramps,
they keep on using this.
Wow, I didn't know that one. Okay. Now let's first find a solution, because right here we shall have a long conversation about, because I'm so interested into helping people with drug addiction. Let's talk about the problems you're facing for this show.
Yeah.
Who we're calling out to, who can help, and also government, because right now there's no anybody else who's gonna cry to.
Exactly. So these are the problems we are having right now. Yeah.
Now that you don't have funding.
Now that we don't have funding. First of all, we don't have a secure line of supply chain of methadone as Bale Regional Referral Hospital. We are entirely depending on the distribution from Mutabikaaa. So in case there is no drug in Mutabikaaa,
you also don't have.
You also don't have. And also the distribution of methadone. The contract was removed from GMS, that's Joint Medical Stores, back to the National Medical Stores. And the process the National Medical Stores takes to get this drug is quite lengthy.
And this one is causing so many people to relapse, and so many people coming and they don't get treatment.
Exactly. So you take this scenario that you have given someone hope, and indeed someone is no longer injecting themselves.
And after long, that hope is taken away.
And you tell them the drug is over.
The drug is over. So if we were to go into government systems, who do we cry out that we need this? Because I know there must be a budget somewhere for something like this.
Yeah, the budget is there, and I think they are doing the procurement of the drug. The only challenge is the process takes so long.
And these people have to come daily.
The people have to come daily.
You said something like normal healing will take, or rehabilitation must take how long normally?
It entirely depends on how long you've been on that drug, or you've been addicted to that drug. But the normal healing takes between 6 to 24 months.
That is a year, a half a year, or 2 years?
Or 2 years, yes.
And this is free, because I get so many parents who call me with these issues, and I didn't know MAT is free. And again, MAT or Nyachongambia is not a stay. It's come, pick, go.
Yes, MAT is come, pick, go. Why? MAT, I was still telling you the services that we offer in MAT. Because you can't only give that drug and you achieve the objective of MAT. So that drug is coupled with psychosocial support, that is the counseling. Yes. Then also we put in the socioeconomic empowerment. Then we look at the community psychology, where we go and sensitize the outreaches, the communities. You get it? There are boys and there are people who have been arrested. But because someone stole something to go and sell and
Sell them. Yeah, I've seen that. I've seen that a lot.
Yeah, so most times we go and teach the communities so that they no longer punish, they just require them to match so that
because the people who do drugs can steal anything.
Yes.
Steal anything, like from a shirt to a shoe to I've seen all that.
As long as someone can get that drug.
We shall have a conversation. Then the other thing I want to know is say now I have a child who's been addicted and I bring them to Luziria and back. How do I monitor them? How do I know there's improvement? How do I check on them? Because of money about addiction, if you put pressure, you're going to lose them.
Exactly. So what happens, we have what they call screening tools. Okay? Yes. And this is, we do it on induction. For example, you've come, it's your first day, shall have to do a urine drug screen on you. To find out which drugs are being used. Yes. And these drugs, we expect them to be in your urine at least not more than 48 hours. You get it? So when we come,
footballers, sports people, when they're checking them for drugs.
Exactly. So when we come, you start the drug, yeah? We shall do continuous screening. But
every time I come to pick the drug,
it's not every
in
time.
A month, you give us the urine.
It is not every time.
I get the time span.
Yeah, it's like a spot check.
Are we improving?
Yes, it's like a spot check. It's like you come for the drug. I'm like, no. You first go and see the counselor or the psychologist, and after you go and see the nurse or the clinic officer who is there.
Okay, this podcast was mainly to cry out for help. I don't know if there are any names you can mention to say, please help us here and here. You never know how far this can reach. We can reach Uncle Balam and he helps us. It can reach DG, Uganda AIDS Commission, he gives us help, or Ministry of Health, or whoever is in charge. They may not be knowing what exactly, not in a bad way, but they may not be knowing you're going through this, because I'll try and send it as far as I can.
Actually, let's first talk about the problems. We've already talked about one.
Okay.
Yeah, it's more than one problem. So, the first problem was us not getting methadone on time. That is one. Then the second problem, because we are not getting methadone on time, we are not recruiting, we are not inducting.
We can call them clients.
Yes, we are
or
not
new addicts.
Yes, we are not inducting clients.
New addicts because you don't have anything to.
The stock which is available is to only maintain those who are in
who have been here.
So we can't.
And that which is very risky to society.
It is very risky,
deadly.
because these people are coming on their own.
A drug addict can do anything for drugs, so he can break a house, he can.
Exactly. So
he can steal a phone, he can steal anything tiny. So that's society mess.
Exactly. And imagine that it is one facility in Eastern Uganda. So some people come from as far as Ginger. To come, you tell them we don't have that drug.
I'm still even wondering why the only two.
Yeah,
I went to Mbara, I was shocked these things are there. Went to Guru, found them. Like, I had artists, I used to move with artists.
Yes.
And you think you're up country, they can't get them. And boom, they're called what? The plants who give them the ones who bring them, not cartel. They have a name they give them, I forgot the name. Okay, continue the problems.
Yeah. So the third problem, is about the human resource. Yes. The government, through Ministry of Health, who promised, as they validated the previous people who were supporting these activities, and they promised that these people were going to be absorbed in that government payroll.
Who? The addicts?
No, the HR. The clinical team. The clinical team supporting the facility. So government had promised.
I thought those fall into like the way you working in Mutabikaaa. Baba Sasulanga Abasawa Wakula Mutabikaaa. They are not in that.
No. Remember, these people were initially being paid by the NGOs.
Oh God. So wow. Yeah. So in the budget the government didn't implement them because they thought they were already sorted.
Exactly.
Or they didn't remember now that they are not sorted.
But the good thing is government carried out a national validation of all health workers who were being supported by USAID.
And what are they doing about it?
They promised that they are going to take in these people.
Okay.
Yeah, so we are still waiting to see what happens. But the HR issue is also becoming
a big issue.
Because these are the people who have been working like volunteers since 2025 and have kept these clinics alive.
Without pay?
Yeah, without pay.
That's a trick one.
Yeah. So that is the side of the clinical team. Then the other problem we have is the relapses. The relapse rate is high. We are talking about in Bali we have at least 50% relapse.
Relapse is the person taking the drugs and within a few minutes it comes back.
And it comes back. So one of the drivers of relapses is aftercare was discontinued because of the drug funding.
You couldn't afford to do aftercare.
Yeah, we can't do aftercare.
Aftercare is like following up, seeing if they're okay.
Yeah, following up.
Going to talk to them.
Yes, some of them have to be enrolled in vocational institutions.
Yeah, to find something they can do.
To get a skill, an income generating skill. Then after they form
purpose skills.
Yes. Then after they form what they call.
And that was you funding that?
That was the project funding it.
Oh wow. It was doing wonders.
Yes, that was the project funding it. So they form associations. Yes. And the project injects in some capital for them to start earning.
When you say the project injects in some capital, that's the project that was being funded.
Yes.
By the United States. Yes. Now it's not funded and it's not incorporated in government.
Exactly.
Do we plug that to Ministry of Health?
Yes, because I think Ministry of Health signed a memorandum of understanding with the government of United States. Yes. And I think they signed some good amount of budget that I think can take care of all these.
In that direction?
Yeah, in that direction. So I don't know whether it has been prioritized or it was dropped. But you're struggling. Yes.
You have to say so. Let's cut this for now, so that the message goes clearly. I would love. This man drove all the way from Bali, and as we talk, it's like 10 p.m. All in the name of this podcast, so you know how much some people are passionate about seeing society clean. Because if you've been with a drug addict, you know the pain and energy somebody can put in to get them back to normal.
Yeah, true.
Thank you so much. How do people get you in case somebody sees this podcast?
Getting us, it's we have our mother center is in Mutabikaaa, so they can go through Mutabikaaa
and see how best we can.
Yes, because we are working in contact with our mother side, that is Mutabikaaa. So whatever good thing happens this side,
and Mutabikaaa flows down to this side.
Flows down to Bali.
Okay, thank you. Just for time, but I promise we'll be back on talking. I know so many parents who have children who they don't know what to do.
We left out a lot of problems, but I think maybe we shall do that next time.
Right now we're just asking for funding. Next time, if nothing is done, I'll try and send this to whoever can send it. You can come back and explain the problems. Never know. This world is round. Somebody may decide having an NGO somewhere and you get like a connection, a memorandum of understanding. Yeah,
that's true.
Thank you for coming.
Thank you so much.
Bless.
For having me.
Hey, welcome to the MC Cats Talks. Let's talk, let's share, let's smile, let's celebrate, let's learn. Share, subscribe, call a friend, let's join this, the MC Cats Talks. Share with us, sit down, relax.